Hello and welcome to part 5 of spine anatomy. In this lecture, we're going to talk about specific characteristics of thoracic vertebrae. So remember, there are 12 thoracic vertebrae. The first 4 vertebrae more closely resemble cervical vertebrae, and the last 4 thoracic vertebrae more closely resemble lumbar vertebrae. So T5 through T8 are really considered the typical thoracic vertebra. Something unique to all thoracic vertebrae are something called facets, and those are surfaces for articulation with the ribs. So remember, we don't have rib articulations in our cervical spine or in our lumbar spine. So rib articulations are unique to the T-spine. Each of the 12 thoracic vertebrae is associated closely with one pair of ribs. So each thoracic vertebrae has what's called a full facet or 2 partial facets, which are called demifacets, on each side of the thoracic vertebral body. So let's take a look. These blue surfaces right here on the diagram, this would be a full facet, and notice how these are 2 smaller ones. Those would be partial facets or demifacets. Each facet, or combination of 2 demifacets, accepts the head of a rib to form what's called the costovertebral joint. And you can see that relationship here. So here's the head of a rib, and it's articulating with 2 demifacets to form a costovertebral joint. Remember, the prefix costo refers to ribs. Vertebrae that have 2 demifacets share articulations with the heads of ribs, which we see here. There are 2 vertebral bodies that share articulation with one rib. So for example, the head of the 4th rib articulates with the demifacets on the vertebral bodies of T3 and T4. For example, rib 1 articulates with T1, and ribs 11 and 12 articulate only with T11 and T12. And you can see that here. And we'll study ribs more when we learn bony thorax in the next unit. I just wanted to introduce some specific characteristics to the thoracic vertebrae. Notice L1 and L2 here. So these are lumbar vertebrae. They have no facets for costovertebral joints, and that makes sense. Most people do not have lumbar vertebrae. Occasionally, a patient will have a lumbar vertebrae, but it's most common that patients only have rib articulations through T12. In addition to the costovertebral joints, all of the first 10 thoracic vertebrae also have facets, one on each transverse process, that articulate with the tubercles of ribs 1 through 10. So let's pause and look at our diagram. Remember, in the last slide, we looked at these facets. These facets articulate with the head of a rib. But notice, here, this is the transverse process. Here's a transverse process, here, etc. There's a facet on the transverse process. That is for articulation with the tubercle of the rib. And again, we'll study that more in bony thorax, but here you can identify the different facets on a thoracic vertebral body. Where the tubercle of the rib articulates with the transverse process, that is called the costotransverse joint. Okay? Note that T11 and T12 do not have facets at the end of their transverse processes for rib articulations. So, as the first 10 pairs of ribs arch posteriorly from the 10 vertebral bodies, the tubercles of each rib articulate with one transverse process to form a costotransverse joint. But ribs 11 and 12 are exceptions. They only have articulations with the vertebral body at the head of the rib. They do not have costotransverse joints. So to recap, the first 10 thoracic vertebrae have costovertebral joints and costotransverse joints. The head of the rib articulates here, the tubercle of the rib articulates here. T11 and T12 only have facets for articulations with the head of the rib. They do not have costotransverse joints. Okay, so again, this is just meant to introduce you to some of the unique characteristics of the thoracic vertebrae. We'll study ribs more in the next unit. Okay, so look closely here at the cross-sectional view of a typical rib articulation. And we're going to look at the bottom image first. So we're looking from the top down. So this is anterior, of course, and this is posterior because this is our spinous process. Notice the articulations between the ribs and the vertebrae are very closely spaced, and they're actually enclosed in synovial capsules. Okay, so you can see that is demonstrated here. These synovial joints are classified as diarthroidal, which remember means freely movable, and they allow for gliding movements. Note on this slide the spinous process of a typical thoracic vertebrae. So let's look up here on the lateral view. Look at the spinous process and how inferiorly they are directed. So they really point inferior or downward versus horizontal or posterior. So when you are imaging an APT spine, for example, you'll notice that the spinous process of T4 is often superimposed over the body of T5 because of this really downward pointing spinous process. So imagine another vertebral body here, and look at the spinous process of the body above would be superimposed from an AP perspective. All right. A few other details that I want you to know about the typical thoracic vertebrae. So remember, think back to our previous lectures. A typical vertebrae has a body with a vertebral arch. There are two pedicles, one on each side, two laminas, two transverse processes, and a spinous process. And then, of course, there's the vertebral foramen where the spinal cord passes. So let's look here closely at the superior articular processes. Okay, so let's look right at this lower image here. Notice how the superior articular processes really face posteriorly, and the inferior articular processes, seen here, face more anteriorly. Remember, the articular processes join to form the zygapophyseal joints, and that is what you see here. It's the inferior articular process of one vertebrae meeting the superior articular process of the vertebrae below. On each side, between any thoracic vertebrae, you also have those intervertebral foramina. Remember, those are formed on the pedicle. Okay, so here's the roof of the pedicle, and you have that superior notch. Here's the floor of the pedicle, and you have the inferior notch. And when you stack the vertebrae on top of each other, those form the intervertebral foramen. Remember, you have blood vessels and nerves passing through those foramen. So let's summarize the anatomy that we just learned. So, on the first 10 thoracic vertebral bodies, you have facets or demifacets for the articulation of the heads of the ribs. You also, however, on the first 10, also have costotransverse joints, where the tubercle of the rib articulates. Remember, T11 and T12 have costovertebral joints to join with the head of the rib, but they do not have costotransverse joints. Okay, remember we learned the inferior articular process joins the superior articular process to form a zygapophyseal joint. Remember, you have the inferior notch of one vertebrae articulating with the superior notch of another to form the foramen. Here's your spinous processes, of course. Okay, let's add one more layer of difficulty here. The thoracic spine is different from the cervical and the lumbar spine in that the zygapophyseal joints form a 70-degree angle from mid-sagittal plane. So that is what you're seeing here. So here is anterior, here's posterior. And if we make a 70-degree angle from mid-sagittal plane, we would be able to visualize the thoracic zygapophyseal joints. So what does that mean for us? Well, in order to visualize those Z joints or zygapophyseal joints open on a thoracic spine x-ray, the patient must be in a 70 to 75 degree oblique. Okay, but the intervertebral foramina of the thoracic spine, on the other hand, are located at 90-degree angles or right angles to mid-sagittal plane. So again, that's what you see in this relationship here. So if you wanted to see the intervertebral foramina of the thoracic spine, you'd have to position the patient in a 90-degree lateral. Okay, so we're going to conclude part 5 here. In part 6, we're going to look at x-rays and point out all of this anatomy that we've been learning. Okay, if you have any questions, let me know.